Hello dear friends, I am Dr. Azarwani and in this video we will learn more about PCO. What is PCOS? PCOS is a problem with hormones that affects women during their childbearing years, ages 15 to 44. Between 2.2 and 26.7% of women in this age group have PCOS. Many women have PCOS but don't know it. In one study, up to 70% of women with PCOS hadn't been diagnosed. PCOS affects a woman's ovaries, the reproductive organs that produce estrogen and progesterone hormones that regulate the menstrual cycle. The ovaries also produce a small amount of male hormones called androgens. The ovaries release eggs to be fertilized by a man's sperm. The release of an egg each month is called ovulation. Follicle-stimulating hormone FSH and luteinizing hormone LH, which are produced in the pituitary gland, control ovulation. FSH stimulates the ovary to produce a follicle, which is a sac that contains an egg, and then LH triggers the ovary to release a mature egg. PCOS is a syndrome or group of symptoms that affects the ovaries and ovulation. Its three main features are cysts in the ovaries, high levels of male hormones, irregular or skipped periods. In PCOS, many small fluid-filled sacs grow inside the ovaries. The word polycystic means many cysts. These sacs are actually follicles, each one containing an immature egg. The eggs never mature enough to trigger ovulation. The lack of ovulation alters levels of estrogen, progesterone, FSH, and LH. Progesterone levels are lower than usual, while androgen levels are higher than usual. Extra male hormones disrupt the menstrual cycle, so women with PCOS get fewer periods than usual. Now the question is, what causes it? Doctors don't know exactly what causes PCOS. They believe that high levels of male hormones prevent the ovaries from producing hormones and making eggs normally. Genes. Studies show that PCOS runs in families. It's likely that many genes, not just one, contribute to the condition. Insulin resistance. Up to 70% of women with PCOS have insulin resistance, meaning that their cells can't use insulin properly. Insulin is a hormone that pancreas produces to help the body use sugar from food for energy. When cells can't use insulin properly, the body's demand for insulin increases. The pancreas makes more insulin to compensate. Extra insulin triggers the ovaries to produce more male hormones. Obesity is a major cause of insulin resistance. Both obesity and insulin resistance can increase your risk for type 2 diabetes. Another reason could be inflammation. Women with PCOS often have increased levels of inflammation in their body. Being overweight can also contribute to inflammation. Now let's learn about common symptoms of PCOS. Irregular periods. Lack of ovulation prevents the uterine lining from shedding every month. Some women with PCOS get fewer than 8 periods a year or none at all. Heavy bleeding. The uterine lining builds up for a longer period of time, so the periods you do get can be heavier than normal. Hair growth. More than 70% of women with this condition grow hair on their face and body, including on their back, belly, and chest. Excess hair growth is called hirsutism. Acne. Male hormones can make the skin oilier than usual and causes breakouts on areas like the face, chest, and upper back. Weight gain. Up to 80% of women with PCOS are overweight or have obesity. Male pattern baldness. Hair on the scalp gets thinner and may fall out. Darkening of the skin. Dark patches on the skin can form in body creases like those on the neck, in the groin, and under the breasts. Headaches. Hormone changes can trigger headaches in some women. The next question is how PCOS affects your body. Infertility. To get pregnant, you have to ovulate. Women who don't ovulate regularly don't release as many eggs to be fertilized. PCOS is one of the leading causes of infertility in women. Metabolic syndrome. Up to 80% of women with PCOS are overweight or have obesity. Both obesity and PCOS increase your risk for high blood sugar, high blood pressure, low HDL or good cholesterol, high LDL or bad cholesterol. Together, these factors are called metabolic syndrome, and they increase the risk for heart disease, diabetes, and stroke. Sleep apnea. This condition causes repeated pauses in breathing during the night which interrupt sleep. Sleep apnea is more common in women who are overweight, especially if they also have PCOS. The risk for sleep apnea is 5 to 10 times higher in women who have both obesity and PCOS than in those without PCOS. Endometrial cancer. During ovulation, the uterine lining sheds. If you don't ovulate every month, the lining can build up. A thickened uterine lining can increase your risk for endometrial cancer. Depression. Both hormonal changes and symptoms like unwanted hair growth can negatively affect your emotions. Many with PCOS eventually experience depression and anxiety. Thanks for watching. Please let me know if you have any other question.